Hello, I am Dr. Simran Raka, first year junior resident in Department of Radio Diagnosis in Dr. Shankarrao Chauhan Government Medical College. And my topic of presentation is neurosonographic finding in neonatal brain. As we all know, the convenience of neurosonogram as it is easy bedside tool for assessment of brain, particularly in high risk and unstable infants. It does not involve any particular sedation or risk like ionizing radiation. Understanding ecotexture of brain parenchyma and its content is essential to differentiate normal and abnormal areas. The presence of open fontanelle in infant plays major role in ability to image the brain with ultrasound to obtain high resolution real-time images. This study aims to assess the importance of cranial ultrasound as an investigative modality for high-risk neonates and to find out the morphology of various cerebral lesions. The main aim of this study is to calculate the incidence of neurosonogram pathologies in 100 high-risk patients admitted in neonatal intensive care unit between September 2024 to November 2024. Objectives are first, identification of various neonatal brain abnormalities in high-risk patients and to calculate the incidence and categorize into leukomalacia, congenital abnormalities, infectious, hemorrhagic, and neoplasm spectrum, and to find out the overall incidence of each also. Further monitoring of the condition over time is also included. Method is the study design was observational study taking place in our college, Dr. Shankarrao Chauhan Government Medical College, Nanded. Inclusion criteria included high-risk neonates admitted in neonatal intensive care unit. Exclusion criteria was rest all stable neonates. Sample size was 100 patients. Method included by standardized protocol starting with grayscale imaging via anterior fontanelle in coronal and sagittal planes using high frequency probe of Samsung RS85 or GQ Logic EQ. Imaging of normal NSG here in normal infant is seen. First, seeing the periventricular leukomalacia spectrum. So, in grade 1, we can see transient periventricular ecodensity as seen in this patient persisting more than 7 days. Grade 2, this eco density eventually evolving into small localized frontoparietal cyst as seen in these two patients. Third included ecodensity evolving into extensive periventricular cystic lesion involving both frontoparietal lesion as well as occipital regions, and there is a mild dilatation of ventricles secondary to PVL changes also. Fourth included density extending into deep white matter, which eventually evolves into extensive subcortical cyst lesion with severe dilatation of lateral ventricles and third ventricles seen in this patient. Moving on to hemorrhagic spectrum, germinal matrix hemorrhage is the most common intracranial hemorrhage in neonates. It is due to the perinatal stress affecting this highly vascularized ependymal germinal matrix seen in a chordothalamic groove. Moving on to the intraventricular hemorrhage. In neonate, it is believed that intraventricular hemorrhage is result of germinal matrix hemorrhage, which ruptures into the ependymal lining and extending into the lateral ventricle. Subdural hemorrhage, this is mostly secondary to any trauma. In this patient, we can see chronic subdural hematoma on right parietotemporal region with midline shift and left ventriculomegaly. Intraparenchymal hemorrhage, this is rare and considered grade 4 hemorrhage with poor outcome. This also is mostly secondary to trauma only. Moving on to congenital abnormalities, this patient has schizencephaly, open type. As we can see, the cleft wall are separated and filled with CSF. This is lined by gray matter around the cyst. Porencephalic cyst, in this patient we had secondary hydrocephalus. In porencephalic cyst is basically one or more intracranial cyst which communicates with the ventricular system and or subarachnoid space. Choroid plexus cyst is most common, although most of the time it is benign finding. Sometimes it can be associated with any congenital anomalies. Imaging finding an infectious spectrum. This patient had meningitis, and we can see secondary hydrocephalus in this patient also. We can see the neonatal brain parenchyma is very heterogeneous. The result of a study was the incidence of abnormal neurosonographic was almost 36% in high risk neonates, with 14% having periventricular echogenicity, which was the most common finding, 9% having bleed, 5% presenting as leukomalacia, 5% had ventriculomegaly, 3 patient had schizencephaly, porencephalic cyst, and choroid plexus cyst, and 1 patient had meningitis. So this is the pie chart of the incidence and our overall interpretation of our study. Moving on to discussion, the pattern of neurosonographic abnormalities in 100 high-risk units was studied and incidence was calculated to be 36%. Most common finding was periventricular echogenicity, which represented grade 1 hypoxic ischemic encephalopathy. However, it is very important to note that not all HI patients showed cranial findings. 5% of HI patient directly presented with leukomalacia changes. Germanian matrix hemorrhage is the most common hemorrhage in neonates, with overall cranial bleed incidence to be almost 9%. Germanian matrix hemorrhage and hypoxic ischemic encephalopathy are related to weeks of gestation and birth weight of the baby, with incidence falling with increase in both the factors. 5% neonates had isolated ventriculomegaly, and overall incidence with other finding was almost 12%. 3 patients presented with congenital anomalies of schizencephaly, porencephalic cyst, and choroid plexus cyst. Meningitis, though clinically and biochemically, was present in almost 17 patients, but only 1 patient had abnormal cranial findings of inflamed meninges. The conclusion of the study is to highlight the convenience and diagnostic accuracy of cranial ultrasound in high-risk units in NICU. High efficiency of cranial ultrasound in detecting the presence of brain damage and its evolution on regular follow-up guides clinical decisions and prognosis. NSG performed early will contribute with valuable data for a better therapeutic approach and neurological development of pediatric patients. Despite the advantages of MDCT and MRI, NSG is still the most commonly used first baseline modality for examining the newborn brain, considering the low invasiveness as well as easy availability of ultrasound that can easily be repeated at any time. Thank you.